So can we weigh today between the benefits and risk associated with the treatment options available for COVID-19? Dr. Abhita Banerjee.
Thank you, Mr. Atul. This is a very good questions, and particularly in the context of speed. So the speed has been brilliant in this pandemic. The science has been brilliant in this pandemic. But there is a saying that speed thrills, but it can kill also. So unfortunately, we have been going, and now I would like to use some chess terms as requested by Dr. Pandav. Like we had a very new and very fascinated with the new technology. Definitely, it was a brilliant mRNA technology, rapid and other things. But that became the queen, and we were focused in the chessboard only on the queen and promoting the queen. But in the chess, there are other pieces. There are different pawns. There are different pieces. And sometimes losing too many pieces, even if you have the queen, overall public health can suffer. And particularly this happened in our country. We neglected tuberculosis detection, went down by 40%. And now we are going to face the rebound tuberculosis. Similar phenomena we are having with the neglect of measles vaccination. We are going to face the problem with measles vaccination. So just a tunnel vision with only one vaccine. And another problem with this speed of vaccination and speed of mass vaccination, everybody got fascinated with it. The policymakers, the advisors, the people who had been behind the vaccine, naturally, for them, it was definitely a very exciting thing. But in that excitement, we have to see, we did not use the art of medicine to calibrate, to see who require the vaccine, and like we rolled out to even young and healthy people, which was particular the world. In fact, we are not as bad as some of the developed countries like America. They are going down to children as young as 6 months. So this is something which was the downside of it, because these people were never at risk of severe disease or death. And the vaccine is really new, rolled out in record time, and nobody knows what would be the long-term side effects. Already there are some concerning reports from developed countries from hard data that there have been rise in myocarditis cases and other things, particularly in young people. So this can be a cause of concern. And particularly in our country, we are a very vast country, 140 crores. We have vast tribal areas, rural areas, remote areas where there are no health infrastructure. So rolling out such vaccine, it would have a very compromised adverse events reporting system, given a poor infrastructure. Going with such mass scale vaccine program and catching the adverse events is a challenge even today. And it is just like having a super fast train and trying to run it on very old rickety tracks. So this is a learning lesson for us. We have to overall improve the health system. We have overall, and another learning lesson is this vaccination and COVID. We have got very good developed this digital technology that in real time, every 24 hours, we are getting the number of cases, number of hospitalizations, number of deaths. We should use this technology to expand it to actually other disease burdens. Like we have got dengue cases. I was seeing since October 2022, we do not have the data on the website of update of dengue. And dengue definitely is a more serious problem in our country than COVID, particularly in young people. Similarly, for other typhoid and other diarrheal diseases, we are losing more than 2,000 young children every day. We are losing more than 2,000 people to tuberculosis. So again, like a chessboard, we should see the whole board, not only see one piece on the board, that is COVID and COVID vaccine. So the technology has been very good. And again, another thing that so much fascination with the vaccine by whatever the scientist who developed it is natural, and by the manufacturers, that we downplayed the natural immunity also, particularly in a dense country like India. After the second wave, 70% of our population had natural infection, and 80% of our children, young people, had natural infection before the rollout of vaccine in children. So for them, we could have calibrated, we could have waited for the rolling out the vaccine for them. And it would have also given us a control group, because now there is a lot of concerns and lot of claims and counter claims that the long COVID is causing certain heart problems or vaccine is causing. So with this, we should, as I said, the science has been lopsided. we should have seen the whole picture, which is country specific. In our country is not same as other countries. We have a very high dense where the natural infection spreads very fast, and similarly the lockdown and other things doesn't work in our country because our homes are more congested than our workplaces. So if you lock down, close business, close schools, we are, and that perhaps accounted for very fast spread of infection in our country. So I think we have to take a more wider perspective in future. Thank you.
Completely agree.